here this afternoon.
My pleasure.
And today we're talking about strokes. What exactly can cause a stroke?
So a stroke is when the term that doctors use when a part of the brain is damaged because of a problem with blood flow. There's actually two different types of strokes. One is called a thrombotic stroke, which is where the blood vessels clot off and decrease the flow of oxygen. And then there's a hemorrhagic stroke where the blood vessels burst and allow the blood to seep into the tissues of the brain. So when they affect people the same exact way. If the brain tissue is damaged, you're going to see the same results. And the effects depend on a lot of things, including which part and how much of the brain is affected. And how quickly the stroke is treated is absolutely a prognosis factor for how you're going to recover.
Okay, so whenever someone thinks they might have had a stroke or are with someone that thinks they might be having a stroke, what should be happening? What should people be doing?
So remembering the acronym FAST, F-A-S-T, is a good rule of thumb for whether or not someone should be taken in to be evaluated. So F stands for face. That means, does the person's face look uneven or droop on one side? Arm, does the person have weakness or numbness in one or both arms? Does one arm drift down if the person tries to hold out both arms out? Is the S is for speech. Is the person having trouble speaking? And time is the T, and that's one of the most important factors, because getting to the hospital as quickly as possible will minimize the damage from the stroke and can also have an effect on how much of function the person regains.
Okay, so regardless of what type of stroke they are having, the response is the same.
Correct.
Okay. Thank you so much, Dr. Brooks. And thank you for joining us in here today and teaching us all about strokes. I know a lot of people have either known someone who's had a stroke or maybe even had a stroke themselves. So thank you so much for stopping in here.
Thank you.